It's time to bring in our good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Talk a little sports medicine this morning with our good friend, Dr. Joe. And, Joe, what do you have for us today?
Well, Ray, I want to talk about educating about a tool that is so helpful to us in sports medicine now, and over the last 10 to 15 to 20 years, it's become invaluable in making more accurate diagnoses, quicker diagnoses, and things like that. Some people very well aware of the tool ultrasound. Others not so much. There's a lot of confusion about it. Part of the confusion goes back in time, as is often the case, way back in when I started in a career in the late 70s, 80s, and things. There was a treatment called ultrasound that we use and still do use. Helps break up scar tissue, helps bring warmth or massage to an area where maybe there's a soft tissue injury. That's ultrasound that we use for treatment. But in the 1980s and 1990s, there started to be an ultrasound that we use diagnostically. And so the surgeons, and especially in emergency rooms where they need quick diagnoses, they started to use this tool called ultrasound where you could see a lot better than actually a lot of other imaging tests, like even MRIs and ultrasounds, MRIs and CAT scans, what was going on, and you could see it pretty quickly. And so these things were used at what was called the point of care. They could use them right at the bedside, and there was a very rapid increase use in the 80s and 90s in emergency rooms of these tools. And what they'd be used for, and what they're used almost exclusively for in emergency rooms now, is if there's like trauma, like car accidents, or there's an assault case, or other sorts of trauma and things like that. They use them to look to see, could there be bleeding in the abdomen? You couldn't tell that before. There was no way to know. And was there going to need to be a reason that we were going to have to maybe even move into the surgical realm on these things? And so ultrasound has become very helpful to emergency room doctors looking for organ ruptures, like, hey, did they rupture the spleen or the liver and things like that with a bad injury, traumatic injury? And also even cardiac issues to the aorta and other things. This tool has become extremely helpful. And so starting in about 2000, it was something that moved over into the musculoskeletal realm for sports medicine. By 2005, 2010, these were being used much more frequently. They said during that period there was about a 700% increase in sports medicine of using ultrasound to help with diagnoses. And in about 2010, 2015, all of our fellows, everybody who trains in sports medicine for us, we at Children's have had about 48 fellows through the years. They now, in the last 15 years, they have to be trained in how to use this tool before they leave our center. And we were really blessed to have one of the best in the region. Is our director, Dr. Derek Eddy, is just really, this is where he's one of the best in the region. But all of our team, our younger team, is all trained in using this ultrasound. And a couple things that make it so beneficial. Number one, I mentioned already, the portability. And the portability keeps getting better. The portability of these tools, they're handheld tools now. They don't have big wires attached to them. Very easy to use. Secondly, you get immediate results. So you know right there in the clinic, even now, in the last several years on the sideline, you can use these tools, and it gives you information for diagnosis immediately, immediate information and making these diagnoses. The other thing, Ray, very cost-effective and very safe. And so from the standpoint of the days, hey, let's wait 3 days and get an MRI, or we got to get you down to a unit for a CAT scan and things like that, these units can be used immediately and very, very beneficial. So I'll tell you a couple reasons now that we use them on the sidelines, and it has given us great benefit. Number one is with soft tissue injuries. We gathered almost no information from the old imaging tests that we use, x-rays and things like that. of tendon injuries, muscle injuries, ligament injuries. Very, very good. One thing Dr. Eddy was telling me last night on the phone, really, really good images of nerve injuries, too. So as these units have gotten better, they really, really helpful to even seeing injuries to the nerves that these athletes have. Is it a tear? Is it a bruise? Is there bleeding or swelling around it? Is there what we call edema or swelling that we need to deal with to help this athlete? Ultrasound's awesome. The second thing is you can put the athlete through a range of motion. So maybe the tendon looks okay to start with, or the muscle, and then you actually try to put them through a range of motion, and you can see, now there's a tear, there's an injury here. They're not going to be able to go through a range of motion. They're not going to be able to return to play and do the things they need to do on the field to play. And so these tools have been extremely helpful. And again, like I said, you can see bleeding and swelling, and very helpful. Number 3, guiding for injections. So you know that injections have become a big part. We've talked a lot about certainly the old standby cortisone that was useful all the way back 60s, 70s, still useful today. But now a lot of other things, PRP and some of the regenerative medicines that we use, you want to get that medicine exactly where it's necessary. So previously, Ray, before 2000, we did what was called blind injections, blind examinations. We really didn't see where we weren't positively sure where you were putting the medicine for cortisone and things like that. Nowadays, these great big screens, great technology, you can see exactly where the problem is, where the tear might be, where the bad bruise is, where the injury to the soft tissue, and get the medicine in exactly the right spot. So it guides the injections. And fourthly, we talked a few months ago about these newer tools like shockwave therapy and stuff to break up some of the scar tissue. You can see this very well on ultrasound immediately. And so you can get that treatment done that day. And so this point-of-service use has really helped a lot from the standpoint of diagnosis, from the standpoint of very good affordability and safety, and in making good diagnoses about returning people to play. And we're blessed that we at Children's have some of the best technology in the area. Many of our centers now have these ultrasound units, many people using them on the sidelines, and we have one of the best in teaching it is Dr. Eddy, who came to us and started teaching this 15 years ago. And the field of ultrasound medicine to help with diagnosis has just exploded in usefulness in helping sports medicine making diagnoses.
And Joe, it probably goes without saying, with all the facts you presented to us, also speeds up recovery time when you're able to isolate like that.
Sure, and we're more exact with what we're dealing with too, Ray. So this has been really helpful rather than the guesswork of, 4 to 6 weeks with this soft tissue injury. And no, we know exactly what this is. This is a bad bruise. This is a grade 2 tear. This is a grade 3 tear that we need our surgical friends to help us with. You can tell that pretty much immediately right at point of service in the clinic, or even now on the sidelines. You will be seeing our primary care sports medicine people using this unit, these handheld small units, ultrasound units, to help making these diagnoses. And you're absolutely right. We're a lot more accurate than we were 10 or 15 years ago.
There you go. Great sports medicine center here in this Akron area, as Dr. Joe mentioned, right at Akron Children's Hospital. Joe, thank you, my friend. Always appreciate the time, the effort, and really good education into the world of sports medicine. Thank you.
Thanks. Thanks, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, part of this morning show for over 30 years here at 93.5, 1590 WAKR. Really good information.